welcome you to the August 6th Community and Provider Forum. I will be sitting in for Director Andrew Reese today. And as per usual, we'll start with our COVID statistics. All right. Is everyone seeing my slide deck? Is that a yes?
Yes.
All right. Thank you. Okay. So, um, thankfully for this part of the month of August, July, and June, we have no new COVID positive cases. Uh, the statistics per setting site regarding infection per setting type have relatively remained unchanged. The death rate by placement type has shifted a bit as we've had in the month of July. I'm sorry, in the month of August, we've had 3 deaths of people who have uh, at some point tested positive, but we are awaiting. I'm sorry, that was July, but um, we're awaiting the actual input from the Office of the Chief Medical Examiner. And what happens there is of the people who've died who had COVID, we currently only have confirmed that 37 of them actually expired from COVID related anomalies. And we have confirmed that 14 who died thus far are not as a result of COVID, and leaves us with 9 cases pending that we are awaiting the determination as to the actual cause of death. To date, we have had 700 provider staff who've tested positive, 51 who work for more than one provider, and unfortunately, 10 staff who tested positive have died. To date, DDA people supported have been vaccinated at a rate of 76%. And here you see the breakdown of setting type with 77% from host homes up from 75, 97% from ICF up from 96, and 58% from natural homes up from 57, residential habilitation 96% up from 95, supported living 84% up from 83%, and thankfully provider staff up 2 percentage points to 63% total. And we have a new statistic to report to you this week that DDA staff have been vaccinated fully at a rate of 73%, and that is with 86% of our entire staff group reporting. So we can move on. At this point, I will ask if there have been any questions submitted at this point. I have not received any questions via our usual mechanism for questions, but I know we get questions via text and email to particular members of the executive leadership team. So I'm just going to ask if there have been any questions submitted. Hearing nothing. You know, there was a point when I was like, wow, there are no questions. But what I realized is we've been doing this for pretty good while weekly. And I would assume that, you know, based on my understanding of research and statistics, that we would reach a point where we probably answered just about every question. And I do know that we've answered certain questions about 10 times. So, you know, we appreciate the opportunity to come to you. And so I have just to clarify our vaccine data. When we present the percentages of people who've been vaccinated, we have statistics on those who've received one vaccine awaiting the second vaccine, and we also have statistics on those who have had the Johnson and Johnson. Um, it is important to note that um, we need to stress the importance of getting fully vaccinated, specifically with the fact that the Delta variant is out there. We do have resources where we are educating providers in terms of their nursing staff, as well as we have nurses who are reaching out to families who live in what we call natural homes or people who live independently. We have nurses reaching out to them for those who've reported hesitancy or flat out refused the vaccine. We are following up with them on a consistent basis to kind of help them to understand the importance of the vaccine and to also assuage any fears that they have that the vaccine will cause them harm. We have been able to encourage a few people. Thus, you see the uptick in percentage points because we had reached a point where these numbers had become relatively stagnant. But as you see, we have had a slight uptick in percentages, and we believe that that's through efforts of our team here reaching out, as well as our provider staff reaching out to people. And we'd also like to just, mention that our providers have done what we consider, for the most part, a yeoman's job of ensuring that their staff have been at least educated when there is hesitancy and encouraged when there is not to receive the vaccine, and using various methods, investing in terms of offering incentives, sharing incentives that the city has out for people. And so we just hope that that continues. We're really encouraged by the slight movement, albeit of the percentage points of people who've been vaccinated.
Winslow, we have a couple of questions in the chat room.
Okay, could you post a link to agency-specific staff vaccine rates? I will defer to HR on that, but I do not believe that we have the ability to, at this point, break out those staff who have been vaccinated. But I will say that within our staff of approximately 429 people, approximately 113 of those staff are service coordination staff, 20 are health and wellness and IMEU, which make up about, I would say, a little less than a third of the agency, and RSA is also a significant number. So I don't know that we yet have the ability to break out which staff specifically in terms of job description. I believe you would be asking for job type and description. With the Delta variant out there, are to expect any new guy. Oh, I guess it's are we to expect any new guidance from DC Health? So I will defer to my colleagues at DC Health who so graciously have joined us today. So
Thanks, Winslow. There is new guidance on mask use that has posted on coronavirus.dc.gov that is available for, let me just get the title of it is Mask and Cloth States Covering Guidance for the General Public, that was posted July 30th. That's available. We're also currently in the process of updating some of the mask language in our healthcare facilities documents. And just so that everybody knows, the mayor's order was released after the healthcare facilities guidance, and so that supersedes the guidance that's currently posted until it's updated. And so we would encourage everybody to follow the mayor's order to the best of their ability until specific setting guidance is released from DC Health and update it.
Thank you so much, Nelson, for being here and providing us with that information. I also see that there has been response to the original, the first question regarding the agency, and forgive me, my assumption was our agency because I've been very excited to be able to report on our staff, but the actual question was referring to provider staff vaccination rates, and if that information is updated. I think we get that bi-weekly, and the information on the website is updated bi-weekly. I'm sure if I'm incorrect, I'll be corrected on that, but I believe that is a bi-weekly update. We require providers to update us on that. And, the good news is we have some some agencies that have a 99% rate of fully vaccinated staff, as well as a few providers that are very low in terms of their percentage points. We have, what is the statistics on people we support COVID data? Thank you. What is the statistics on people we support COVID-19 data? Number of people affected, number of people deceased. Sorry to take you back. All righty. So we have 429 people from the onset that we have had a positive finding of COVID, and we've actually had 2 people who've tested positive twice, with one being a false positive. So one person has tested positive twice. And of the 429 people who have tested positive for COVID, there have been 60 people who have expired. And of that number, 37 of those people have been confirmed as having expired due to complications of COVID. 14 have expired without COVID being the cause of their death, and we're awaiting the Office of the Chief Medical Examiner or the state of Maryland's medical examiner's confirmation as the cause of death in 9 others. So 429 and 60 are the numbers. 429 being people who tested positive, 60 people have expired, 37 as people who have been confirmed as having expired because of COVID, 14 expired not as a result of COVID, and 9 pending. All right. Let's see. Okay. And I posted the link to the provider staff vaccination rates on the DDS website. Thank you so much, Ms. Bernstein, for doing that. The link shows the rates of provider staff by agency in terms of the percentage, because of the privacy and our protecting or attempting to protect the privacy of those provider staff. We can't give you much more than the overall percentages from companies. Several people supported are interested in taking a vacation in the state, in quotes, next month, and we want to make sure this is okay for people to spend time away from their home. Those traveling are vaccinated, and the staff identified to accompany them are also vaccinated, and we wanted to confirm local travel is okay. All right, well, that is a very good question, and based on what we know, people can travel using the same precautions. And right now, there is no quarantine requirement for fully vaccinated people to quarantine once they return to the District of Columbia. And I've also been told, that the information on the website is over a month old, so we'll ensure that that's updated. There hasn't been much of a change in the overall percentages of provider staff. The 2% change since the last time I believe that information was posted. So if Kirk Dobson is here, he may be able to share some light on the provider staff vaccination rate. Kirk, you on?
I am. Thank you, Winslow. Yeah, so the overall rate right now is at 63%. And so we are going to update the website soon. But yes, not much of a change from the last posting in July 2nd. Thank you.
All right. And what I'm learning is that some of the questions are being posted in the wrong place, but they are getting to me. So there's another question/comment. The provider community is experiencing a great deal of problems with the TME certification renewal. And for those who don't know, TME stands for Trained Medication Employee, and this is a certification whereby direct support professionals go through a specific training by registered nurses and have the ability to administer certain medications under the supervision of nurses. So not every DSP can administer medicines, but those who have met the requirements for certification as a trained medication employee can. This certification is not transferable as it is, they must administer medication to people who they support regularly and that they are familiar with. It's not whereby they can just administer medication to various locations. They have to be able to administer medication on people that they are familiar with. If in fact a doctor orders a new medication for a person, the registered nurse is required to administer that first dosage and to oversee the administration of that new medication by the trained medication on the next dosage. So it is what we consider thoroughly regulated process that allows unlicensed professionals who are certified to administer medication. So the comment is the provider community is experiencing a great deal of problems with the TME certification renewal. Can DDS extend an invitation to the Board of Nursing to participate on this weekly forum? It would be great to have a Q&A with them to clarify this process. Thanks. And what I can commit to doing, we have a regular call with the Department of what used to be called the Department of Health, DC Health. And I do have a working relationship with members of the Board of Nursing. And so we'll definitely reach out to them. And when you say challenges, it would be also good if you could email me personally with specific challenges so that when I reach out to my colleagues at the Board of Nursing, I'll be able to share with them what you're experiencing in the process. I can tell you that overall, because of the pandemic, everything down to renewing your driver's license, registering cars, new car registration, renewal of licensures, handgun permits, everything that you can imagine has been sort of delayed. And I know this personally and anecdotally from accounts of friends and people within the community. So, but if you send me the specifics on the TME process, I will definitely have the Board of Nursing and see if they'll be available to take your questions. But if we can provide you the answers as well, we'll get you that. That should have been provider vaccination percentages, not certificates. Sorry for the typo. Sorry. Let me go back. Robin had a question. I'm sorry, I don't see the question, Robin, that was being clarified, but okay. Is someone from DC Health able to confirm whether the home tests available at the libraries are PCR tests? This information is hard to find on the website at coronavirus.dc.gov /test yourself. So I'll defer to DC Health on that question. The question is whether the home tests available at the library are PCR tests. Oh, the answer is, oh no, I'm sorry. Are those PCR tests that are available at the library, DC Health?
Winslow, I'm trying to find out the answer to that now. I can't speak to it right this second, but do you know what the name of those tests are that they have at the library? That would be helpful as I reach out to my lab colleague to find out if it's a PCR test.
All right, so Carl, the question is, do you have more information on the name of the test? We have someone looking into that now, so if you could type that in the chat, it'd be good. All right. Our organization provided office resources for renewal of TME using our technical support person, but at the point of payment, nursing board window did not open. So I believe that's a comment. And again, let me copy that to my little follow-up question document here. Carl, when the results came back, it stated that it was a PCR test I can send to you, and that is from Cortina. So in answer to your question, Carl, I believe Quintina answered that it is a PCR test. So Nelson, I think we have the answer to that. Another question, TME challenges have been shared by the coalition with the Board of Nursing. The challenges are it takes up to 4 to 6 months to get a date for the test. Solutions, tests should be electronic and trainers should be able to facilitate this. As I am reading this question, I do recall that when we first started these forums, that was a concern, and the issue was the ability to be able to have the testing done electronically. And what I do remember is that the Board of Nursing offered additional sites, but that it was not a test that could be done outside of the testee actually showing up to the specific testing site. So, but I will definitely seek some clarification on that. DC Health has been going through a few changes, but I will reach out and find out more information on that. It was a request to note the date of the latest update of the staff vax percentages on the website each time they are updated. So Kirk, could you give us the date of the last update of the posted data that's on the website?
I believe it's July 2nd, but we will update it as soon as we can. Thank you.
Thank you. Also, I'm learning that it's taken way longer than it used to get approvals for new hires to become TMEs. I do know that our very own Michael Siegelman has been training nurses on their ability to train TMEs, but I wasn't aware that it's taking longer for the process to happen fully. So again, I'll look into that as early as today, begin looking to see what we can do. It would be helpful.
Michael's available if you need him to speak.
Oh, okay. So, Michael, could you just provide us an update on what you've been doing in your role of supporting nurses who are training TMEs?
Sure. Can you hear me?
Yep.
The class is monthly. It is, I believe it is the Yes, it's the second Monday of every month. And I send out the notification every month before the class. We will be using WebEx again, so everyone on the RN and LPN nursing list should receive that invite today. I am also aware of the delay in DSPs being approved to become TMEs. And as you said, I know that DC Health has been working on that. I did see on their website that the application process is open again. So what I tell my students is that, you know, I'm not in control of anything at DC Board of Nursing, of course. I'm just one of the trainers, one of the two trainers that provides the class. So I know that if people contact DC Board of Nursing to get that detail about when the to confirm that the online training or that the online accepting of the applications has begun again. I have not heard an update yet. I believe what I was told from Dr. Jenkins at the beginning of the pandemic was that people were, it was sort of a reciprocity process to become a TME. However, the provider had to do everything that DC Board of Nursing would normally do, which, and I told this to all of my classes, that includes um, the background check, the fingerprinting, the unit test, and making sure that the observations are performed by all by the supervisory RN. And let's see, feel free to email me, or obviously Winslow said to contact him, but feel free to email me if you have any TME questions as well. My email is my name, michael.sigelman@dc.gov. And
Post that in the chat, Mike.
oh, I'm sorry. Yes, sure. But as I've told my students in every single monthly class, they need to pursue the answers directly from DC Board of Nursing, because the two master trainers that train the nurses to become TME trainers, we are not in charge, of course, of what DC Board of Nursing does. I'm just the messenger. So, but feel free to ask questions, and I will do my best to contact Dr. Jenkins and post those questions and share those with Winslow as well, if that's helpful.
And just for the record, when you email me, I would email Michael, and Michael would be, in fact, the point person. So thank you, Michael, for sharing that. If you want to bypass the messenger and go directly to the source of TME contact with the Board of Nursing, it would be Michael Siegelman. Thank you so much, Mike. I have a comment that it would be helpful if DC Health would specify the type of test on the packaging, since there are accuracy differences between PCR and other COVID tests. Thank you, Nelson, for communicating that to your DC Health colleagues. So we will have DC Health follow up on that. So I had the pleasure of sitting in on a call with medical directors around the country um, managed DD systems, and um, there are a couple of states that are seeing an uptick in their target population with regard to positive COVID tests with people served and staff. And I was pleased that in the district, we fortunately have seemingly, uh, thanks to our provider community and education from our teams here at DDS, as well as our relationship with the wonderful DC Health unit that's been on the forefront of helping us through this, we've sort of seen our target, just target population just sort of come to sort of a screeching halt. And I'm very thankful for that because um, we also know that, you know, this virus can be catastrophic for people who have co-occurring conditions or comorbidities, as they're called. So, yeah, we'll take any questions that you guys have. If you have no more, we'll just, you know, wait a few minutes and give you a few minutes of your life back. Um, but we'll wait a couple more minutes and see if there are any more questions that come in. We have a question. Are there any updates on the retainer? And has been stated on this call, once we receive approval of the current Appendix K from CMS, we were going to submit another amendment to the Appendix K that dealt specifically with the retainer. And the thought behind that is to avoid delay. When we make multiple changes within the Appendix K, it's been our experience that it takes a longer period of time to get those approved. So once we receive the approval for the Appendix K that is currently with CMS, we were going to resubmit a amendment that dealt specifically with the second round of retainer payments in hopes that it would not cause a substantial delay because it would be specific to the retainer. So that's our update on the retainer. All right, we've gone approximately 3 minutes without any questions, which leads me to believe that we've probably answered all questions today. And if we haven't, if you want to, you can reach out to me later and I'll put my email address in the chat. So with that, we'll end this call. I'd just like to say, everyone, thank you for joining us today and continue to remain safe, be vigilant, and hopefully you have a great weekend. See you next week. Bye.